5 frequently asked questions for patients who have high blood pressure or hypertension. Number 1. Should I stop taking salt completely? No. One must understand the difference between salt and sodium. Salt is not the culprit per se. Salt is composed of sodium and fluoride, of which sodium is 40% and chloride is 60%. Sodium plays an important role in water retention and can cause fluctuation in blood pressure. Therefore, to restrict sodium intake, one must quantify the amount of salt taken per day. For patients with high blood pressure, salt intake should be minimized to 3 grams per day or half a teaspoon per day per person. Number 2. Instead of regular table salt, can I take low sodium salts? Low sodium salts are usually high in potassium. Even though potassium is good for your heart and muscles, high level of potassium in your blood can cause tremors and abnormal heart activity. Therefore, low sodium salt should be monitored and given under specific conditions in patients with hypertension, diabetes, kidney diseases and liver diseases. Number 3. What are the other sodium sources of food? Sodium is present in most foods that have preservative. For example, pickles, pappers, chips, bread, biscuits, processed foods and even your sauces. So one must take into consideration all these food products when you are quantifying or measuring your salt intake per day. Number 4. What are the food labels that one must look out for the sodium content? There are 3 different sodium food labels that are usually present on most food products. Low sodium, which is 140 mg of sodium or less per serving. Very low sodium, that is 35 mg of sodium or less per serving. And sodium free, which means that the food product has less than 5 mg of sodium per serving. Number 5. If I have hypertension, I should not exercise. Exercise plays an important role in treatment and management of your hypertension. In rare cases where the patient has uncontrolled hypertension or has fluctuations, the doctor might advise them to not exercise. But in most other cases, exercise is a part of management of hypertension and one can do all forms of exercises from aerobics to your strength training exercises. It is important to talk to your doctor to understand your exercise level that is specific to you for managing your hypertension.